So we're going to start going over the anatomy of compact bone. The first thing I want to tell you is that you see these circles. Each of these circles is called an osteon, right? So this circle is an osteon, this circle is an osteon, this circle is an osteon. So I'm going to turn it this way so you can see it better, right? So, I'll turn it around in a few minutes. 1 second. So this one is an osteon, that's an osteon, that's an osteon. So the osteon is what we call the functional unit of compact bone, right? So if I turn this way, bear with me, people, and on YouTube. So this circle is an osteon, that's an osteon. So each circle is considered an osteon, right? And that's, again, the functional unit of compact bone. Now, each of these lines, you see, this line right here is a lamella, or lamellae. And you have this one that looks like a wall right here. It's also a lamella, okay? But there's two different kinds. The one that looks like a wedding cake, this one, is called a concentric lamellae. And the one that looks like a wall here is the circumferential lamellae, right? So the one that looks like a wall, again, is the circumferential lamellae, and the one that looks like a wedding cake is the concentric lamellae. Now, I want to point out, because this is a little difficult to see when you're looking at it for the first time. So I told you that this little circle here is an osteon, right? But it's compressed. It's like this. It's like sort of compressed down, right? But if you it's like a spring. If you bring it up this way, so if he were to point to the whole structure, this technically would be an osteon. But the lines would be concentric lamellae, right? Now, you see that within the circle, you have these canals, right? Actually, before I mention the canals, within the circle, you have little tiny holes in there, right? Kind of like this, right here, and there, and there. These little holes, they're called, let me show you this way, maybe it's gonna be easier to see. Oh. So, the thing is, I can't see now. Like this little hole here, each hole is called a lacuna, right? So these holes are called lacuna. Now, inside the lacuna, you have specialized bone cells that we call osteocytes, right? So the osteocytes reside in the lacuna, or they live in the lacuna, right? Okay, so then between these little holes, you have this canal or channels, right? Or these lines in between the holes, right? That connect the holes to each other, the lacuna to each other. So these lines that connect the lacuna to each other are called canaliculi, okay? Like I said, this line here that connects this hole to the next hole is a canaliculi, okay? Now, inside of compact bone, you have a different type of bone as well. You see this, I'm gonna turn this way. Well, actually, let me show Grace first. This pinkish reddish area is spongy bone. So inside of compact bone, you have spongy bone, right? So if I turn it this way for the YouTube crowd, this reddish area is spongy bone, right? And it's inside of the compact bone. And spongy bone is there for shock absorption. So the purpose of spongy bone is to absorb shock. And within the spongy bone, you have this honeycomb structure that we call the trabeculae, which are these things, right? And then, so let me show you the trabeculae on this side. So it's here. There. Okay. So then we got, you see these fibers right here, the bluish sort of fibers that are here? These are called Sharpie's fibers. And the Sharpie's fibers are going to connect this to the compact bone. So this outside layer, this outermost layer, is called a periosteum. Okay? So this outermost layer is called periosteum. So peri means around, osteum means bone. So it's a connective tissue layer that surrounds the compact bone. And it's connected to the compact bone via what we call Sharpie's fibers. And these are these little strings here. Let me show you this way. Like that. Okay? Now, we're almost done, so just bear with me for a few more minutes. So, you see that in the middle of this osteon, you have what we call a central canal, right? So, in the middle, you have a central canal, and that's a passageway for blood vessels, right? The central canal can also be called a Hervasian canal, right? And when there's also a passageway for blood vessels that's horizontal, which is this one here. It's not necessarily in the center, but it's horizontal, and that's called the Volkmann's canal or the perforating canal. So if it's going horizontally like this, we call it the Volkmann's canal or the perforating canal. And if it's in the center of the osteon, we call it the central canal. Okay? And let's see. So this here, if he points to here, this would be a central canal. If he points to here, this would be a Volkmann's canal or a perforating canal. Okay? And I believe that's it for the compact bone.